Yo, 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 what up, y'all? It's your boy Rob coming back at you once again with another live stream. So before we get started, you already know what to do. If you're not subscribed to the channel, make sure you hit the bell icon twice. Smash the like button, share this video out to all of your followers, and let's get into it. All right. So shouts out to everybody that comes into the room and smashes that like button. Also, if you're not subscribed to the channel, you know what to do. Make sure you hit the bell. All right. We got some interesting developments, not only with C19, but with some other things. All right. Monkeypox, if you guys are not aware, has been declared an emergency in two locations, one of which is San Francisco. We'll be talking about that. We'll be talking about some movement and some patterns with C19 and how it's spreading, because in case people did not know, it is still continuing to spread. It is still an epidemic and it is still a big problem. All right. So let's actually get into this. All right, we have an article right here, and this is an article from the Associated Press. And what it says is San Francisco declares an emergency over monkeypox spread. All right. So, like we said, this thing was going to be a problem. It's something that was identified early and could have been managed. Clearly, it wasn't. I don't know what to say. You know what I'm saying? We called this in the beginning. If people have not checked out the content that we've done on monkeypox, I would advise everybody to do that, because now we are getting to the point of where we predicted that it would be. All right. So let's actually get into this article. So now here it says San Francisco. The mayor of San Francisco announced a state of emergency Thursday over the growing number of monkeypox cases, allowing officials to cut through red tape and fight a public health crisis reminiscent of the AIDS epidemic that began devastating the city in the 1980s. So now, do you guys recall this exact same government was the same government saying that monkeypox was not an issue? I think that there was a lot of people that were saying that monkeypox is an issue. It absolutely is something that needs to be paid attention to. It is something that needs to be remedied early, but for whatever reason, that was ignored. And honestly, if you ask me, I still don't think that it's being taken care of and dealt with appropriately, but that's another story for another day. All right. So now here it says we are in desperate need of vaccines to support people of San Francisco. Mayor London Breed said the city has been pleading with federal health officials for more help, she says, but it's fallen on deaf ears. Now that's interesting. That's interesting. Honestly, I would actually tend to believe that, because as we've been paying attention to the monkeypox spread, it doesn't seem like people have really been taking this thing serious. I guess it's serious now, you know. So now here it says the declaration, which takes effect Monday, has welcomed was welcomed by gay advocates who have grown increasingly frustrated by what they call San Francisco's lackluster response to a virus that so far has affected primarily men who have sex with men, although anyone can get infected. Now, we've talked about it in terms of this. We've talked about it in terms of this. So I just find that interesting. I find that extremely interesting because, to be honest, in my opinion, it was the media outlets and the government who were sidestepping the issue of the fact that this affects primarily the LGBTQ community. We'd been saying on the channel for a very long time, hey, there's something up with this. This right here is causing a lot of issues with one particular group of people. Nobody else was really talking about it in that way. And we also said that by them not talking about it in that way, by them sidestepping these issues, that would be a contributing factor to this disease getting out of control. And what we're seeing now is that this disease is indeed out of control. So now here it says San Francisco was at the forefront of the health public responses to HIV and C19, and we will be at the forefront when it comes to monkeypox, said Senator Scott Weiner, a Democrat who represents the city. We can't and won't leave the LGBTQ community out to dry. Now, again, I find it interesting. In my opinion, if you ask me, the LGBTQ community has been left out to dry since the beginning of the first monkeypox cases because they weren't honestly reporting it. They weren't honestly saying who it was that was getting sick. I don't know what to say. So now here it says San Francisco's health officer, Dr. Susan Phillips, said that the city is an epicenter for the country. 30% of all cases in California are in San Francisco. So that's a lot. That's a large amount. That is definitely a large amount of cases. And we all know about the population of San Francisco. What's up with the population of San Francisco? You know, who lives there? What kind of people? You know what I mean? So now here it says the city has 261 cases out of about 800 in California and about 4,600 nationwide, according to the San Francisco Department of Public Health. A national shortage of vaccine has resulted in people waiting in line for hours for scarce doses, often to be turned away when the shots run out. Members of the LGBTQ community expressed anger and frustration at a city hearing last week, saying they were relying on social media because San Francisco Health Department had not dispensed basic information on testing or vaccine availability. And honestly, I don't feel bad for the LGBTQ community when it comes to this. And the reason why is because the reason why this wasn't getting talked about in the way that it needed to get talked about was because the LGBTQ community wanted to make sure that they weren't stigmatized. They said, well, we don't want to be stigmatized. Anybody, when asked about why this was being talked about in the way that it's being talked about, they weren't talking about it in that way because of the danger of being stigmatized. And we talked about that multiple times. So again, because they wanted to be shielded from critique, now we have a disease that's out of control because the appropriate susceptible group couldn't be properly warned. Now, as a result of that, they're blaming the government. They're blaming San Francisco. In my opinion, the government, the media, Hollywood, all of these places have been more than accommodating to the LGBTQ community. I really don't understand why the LGBTQ community is expressing any anger. So now here it says, members of the LGBTQ community expressed anger and frustration at a city hearing last week, saying that they were relying on social media because the San Francisco Public Health Department had not dispensed basic information on testing or vaccine availability. Supervisor Raphael Mendelman excoriated the department, saying it was unclear why it could not staff phone lines, especially after telling people to call those phone numbers for information, while the San Francisco AIDS Foundation was able to quickly staff an information hotline. It's a bad look for San Francisco, he said. Resident Tom Temprano said it was unforgivable that he was learning at the meeting that his appointment for a second shot would not be honored. The city decided to prioritize first shots over second shots so more people can get some protection. That's interesting. Very, very interesting. So now here it says San Francisco shut down its primary monkeypox vaccination clinic earlier this week after it ran out of doses, saying that it had received only 7,800 doses of a requested 35,000. Officials said they expect 4,200 doses. So now my question is, why didn't they end up getting all of the doses that they ordered? That's the question. Shouts out to Hey Mr. Knickerbocker. What up with it, Hey Mr. Knickerbocker? As you can see, YouTube is being funny But it is what it is. As you guys come in, make sure you guys smash that like button. People will come in eventually as they turn on the app and check out their home screens and stuff like that. So now here it says, despite the problems with the vaccine supply, federal officials said Thursday that the country's monkeypox outbreak can still be stopped amid worries that the U.S. has missed the window to contain the virus. Now, I got a question for everybody that's watching. Do you guys remember when we talked about that window? We talked about that window in the earlier videos when we first started talking about monkeypox. And the assumption was based on the United States historic performance of how they deal with emergency responses, they're going to miss the window. And clearly, we predicted that correctly. They missed the window. Shouts out to Tammy. What up with it, Tammy? So now here it says the monkeypox virus spreads through prolonged skin to skin contact, which includes sex, kissing, breathing at close range, and sharing bedding and clothing, the public health department said. Now, I want you guys to pay very close attention. Shouts out to my man, Emmanuel Carey. What up with it, bro? When we first started talking about this, the first thing that we asked was, why is this not being considered an STD? That's literally one of the first things that we said. That's one of the first things that we asked. Why is this not being considered an STD? We read the articles, and an overwhelming amount of the articles said because they didn't want to stigmatize. They didn't want to stigmatize. So now here it says health officials are asking people who could be at risk to cover exposed skin when out in crowds and to watch for symptoms such as fever, blisters, and rashes. Now, what I find fascinating is that it says it's asking people who could be at risk to cover exposed skin. Now, my thing is, why aren't they saying for people to use protection or to practice abstinence or to be in relationships responsibly? Keep track of your sexual partners. How come that's not what's being asked? Yep. Hey, Mr. Knickerbocker says they always miss the window. I was watching videos of people fall out in Wuhan in 2019. By the time they had folks contaminated on cruise ships, I was wearing masks. Facts. Facts. And just so you guys know, one of the reasons why I have this channel is for us to pay attention to these trends. And we can't count on the government to be competent. So we have to be competent in our due diligence in order to protect ourselves from these kind of things. Shouts out to Val. What up with it, Val? We have to protect ourselves. We cannot count on an incompetent government. And our government is clearly incompetent. So now here it says the monkeypox virus spreads through prolonged skin to skin contact, which includes sex, kissing, breathing at close range, and sharing bedding and clothing, the public department said. Health officials are asking people who could be at risk to cover exposed skin when out in crowds and to watch out for symptoms such as fever, blisters, and rashes. And again, also people should practice responsible sexual hygiene. If you guys agree, people should practice responsible sexual hygiene, give me a thumbs up in the comment section. If you guys disagree with that and you don't feel that that's something that would help, then give me a thumbs down. Okay. The World Health Organization over the weekend declared the monkeypox outbreak in more than 70 countries a global emergency. Now, do you guys remember when we first started talking about monkeypox? What did they say about it? What did they say about it, guys? And what did we say? We said, yeah, we'll sit back and monitor this. We'll sit back and pay attention. But we all know where this is going. You know what I'm saying? We all know where this is going. You know what I'm saying? So that's San Francisco, guys. That's San Francisco. In San Francisco, monkeypox has been declared an emergency. So now, guess what? I don't know if anybody's aware, but in another state, monkeypox has been declared an imminent threat to public health. Monkeypox has been declared an imminent threat to public health. Now, here's my question. What do you guys think about that? New York State Health Commissioner declared monkeypox an imminent threat to public health on Thursday amid a rapid increase in cases. What do you guys think about that? Let's take a listen.
The U.S. documenting monkeypox here in the U.S. New numbers tonight showing the U.S. documenting the most known cases here in this country. What we know about how it spreads, how it's treated, and what summer travelers should remember about this. Here's Ariel Reshef.
Tonight, reported cases of monkeypox in the U.S. jumping nearly 33% in the last 4 days, up from 2,900 to nearly 3,900. The U.S. now with the most known infections of any country. While stepped up efforts to test.
Now, why does the U.S. have the most known infections of any country? Let's pause right there. The U.S. has the most known infections of any country. Now, what I'm curious about is why? Why does the United States have the most known infections of any country? What do you guys think about that? The United States has the most known infections of any country. Hey, Mr. Knickerbocker says because of liberty. If you guys agree, give me a thumbs up. If you guys disagree, give me a thumbs down. And real quick, ladies and gentlemen, you guys are awesome. We got 9 people watching, all right? If everybody smashes that like button, we'll have 16. Remember, guys, we got that goal. We got that goal of 100 likes per stream. So if you guys can help with that, that'd be awesome. Make sure you guys smash the like button. Make sure you share the video out from wherever you're watching. Make sure you guys go to the backup channels and subscribe to all of those. And let's get it. Let's start this over and let's listen, because there's some stuff we need to be discussing here.
Monkeypox here in the U.S. New numbers tonight showing the U.S. documenting the most known cases here in this country. What we know about how it spreads, how it's treated, and what summer travelers should remember about this. Here's Ariel Reshef.
Tonight, reported cases of monkeypox in the U.S. jumping nearly 33% in the last 4 days, up from 2,900 to nearly 3,900. The U.S. now with the most known infections of any country. While stepped up efforts to test and report new cases in the U.S. may account for higher numbers than other countries, experts warn the data is spotty and the real cases are likely much higher.
Shouts out to you, Law. What up, bro?
Most people getting sick are gay or bisexual men, but the virus is transmitted through direct contact with skin. And
so now, how come every time they say that it's through gay or bisexual men, there's always a but, no pun intended, right next to it? Why is that? See, so if you guys paid attention in that last article that I read, the LGBTQ community is upset with the mainstream media and the government because they're saying that they weren't given enough information about monkeypox. I want to know how you guys feel about that. Because while that LGBTQ community is out here canceling everything, there was a bunch of people thumbs downing my videos about this. Hey, guess what? You might not have liked the roasts, but at least I was giving you information about a disease that could harm you. You were getting information about a disease that could be detrimental to your health, more so than what the government was giving. Here on Blacklight Revelations C19 Report, we predicted the patterns of this disease better than the mainstream media did. So you have to decide what it is that you want. You want to be able to be prepared for what's coming at you in life? Or you want to be comfortable all the time? Because in your comfort, now you're experiencing discomfort, literally. Real quick, ladies and gentlemen, we got 8 live viewers. Shouts out to everybody that's watching. If everybody can smash that like button, we'll be at 16. So remember, we got to get to 100 each stream. So help us out by smashing that like button.
Much higher. Experts say most people getting sick are gay or bisexual men, but the virus is transmitted through direct contact with skin and through droplets from face-to-face contact with an infected person for a prolonged period of time. With summer travel underway, the CDC recommending more hand washing and using an alcohol-based sanitizer. The symptoms ranging from fever, headache, rash to blisters usually heal on their own. The U.S. stocking up on the vaccine.
We have been working around the clock to ramp up our response and to make important.
Now, see, another thing that they're saying is that the U.S. is stocking up on the vaccine. You're stocking up on the vaccine. According to the older reports, they said that they already had a ton of smallpox vaccine, which they said would be effective for this. Do you guys remember that? If you guys remember that, give me a thumbs up in the comment section.
Progress in short order.
And David, not everyone needs or can get a monkeypox vaccine, only those considered at high risk. Again, the CDC urging extra hand washing and avoiding any direct contact with someone who's been infected. David?
Ariel Reshef. Ariel, thank you.
All right, so there's that. So now here it says the declaration means that local health departments engaged in response and prevention activities will be able to access additional state reimbursement after other federal and state funding sources are maximized, Commissioner Dr. Mary Bassett said in a statement. The United States, look at this, the United States has one of the highest levels of monkeypox in the world, with over 4,900 confirmed cases as of Thursday, according to the Centers for Disease Control and Prevention. Now, I got to ask you guys this question. Why is it that the United States has so many monkeypox cases? That's the question, guys. Why does the United States have so many cases? You guys are telling the truth in the comment section. You know what I'm saying? Keep it coming. You know what I'm saying? How does the United States have one of the highest amounts of monkeypox in the world? How? How is that the case? Does that make any sense? You know, that's what people always say, is that when it comes to living in the United States, one of the things that people that live here in the United States should be so grateful for is that we have all this health care. The United States has a first world country economy and third world country results. Shouts out to my man Black Manta. Black Manta in Utah with the Black Manta in Utah. My bad. Black Manta and U-Law with the tag team. You know what I'm saying? And yes, absolutely. If you guys have not hit that like button, take a moment, smash that like button. Also share the video out and make sure you take a moment and subscribe to the backup channels. And also make sure you guys do the survey in the comment section. And real quick, if you got an alert, give me a radiation emoji. If you did not get an alert, give me an angry face, okay? So now here it says again, the United States has one of the highest levels of monkeypox in the world, with over 4,900 cases confirmed as of Thursday, according to the Centers for Disease Control and Prevention. So now my question for everybody is, why is that? Shouts out to Val Williams. She's right. She says they weren't listening when you were warning them last week. And you know what else is crazy? They can try to take down content. What if they had just censored my content and been like, the things that you're saying doesn't go with the mainstream media narrative, and we're gonna take this stuff down. If people go back and watch the older live streams that we did when we were talking about monkeypox, literally everything has played out the way that we said that it would. Literally everything has played out the way that they said it would. Now I'm going to give you guys a little sneak peek into some analytic information about this channel. This is an extremely small YouTube channel. An extremely small YouTube channel. But guess what? It gets close to 1,000 watch hours of viewing time every month. Yet the channel never grows. And the reason why the channel never grows is because this isn't, quote, an official, quote, media outlet as far as to give information about monkeypox. Deemed by YouTube. However, I think that if people had to listen to this channel, I think that we would probably have better results with dealing with monkeypox. Just something to keep in mind. Look, shouts out to Hey Mr. Knickerbocker. She says, yeah, because I will leave your replays on even if I fall asleep. I'd advise everybody to do that. That helps. You know what I'm saying? Watch hours are great. The only problem is that the YouTube algorithm does not distribute content equally. You know what I'm saying? They don't distribute content equally. You know what I'm saying? Which is interesting. It's just YouTube. You know what I'm saying? So now look at this. New York has the highest number of cases out of any state reporting those figures, CDC data has shown. Now, you remember Mayor Eric Adams recruited LGBTQ people to come to New York. Remember that. When Ron DeSantis first put out his Don't Say Gay bill, Mayor Eric Adams put out a call to the LGBTQ community to come to New York. So my question is, what is Mayor Eric Adams doing about monkeypox? Shout out to my man Ghostwalker. What up with it, bro? Hey, Mr. Knickerbocker says, I fell asleep with your live on last night, but I left it on. Ain't nothing wrong with that. That helps. You know what I'm saying? And real quick, everybody should watch that live stream that I did yesterday on Black Light Revelations 2. Ask Mr. Knickerbocker. That's a really good live stream. You know what I'm saying? That's the one thing about my live streams. I try to make it so that they're actually relevant to watch again. And sometimes people do live streams. It's like, I'm not going to watch it because I missed the live. I try to make my live streams just as informative and just as good as a video so that they never lose relevance. You could just, if you get a recommended video, you can watch it and it's still relevant. You know what I'm saying? So now here it says San Francisco declared monkeypox a public emergency on Thursday. So we just talked about that. So now I got a question for you guys. Where do you guys think that any more states will declare monkeypox an emergency? Hey, Mr. Knickerbocker talked about the money grab, and I agree. I definitely agree. This will definitely be used as a money grab. And I agree with you, Law. If you guys agree with you, Law, give me a thumbs up in the comment section. If you guys disagree with you, Law, give me a thumbs down. Monkeypox requires over 20 days in quarantine/isolation. Majority of people who get infected aren't going to do that. They didn't even want to do 5 days for COVID. I got to agree with that. So now here it says San Francisco declared monkeypox a public health emergency on Thursday, effective August 1st, which will also help expedite resources to better respond to the rapidly rising cases, city officials said. The city has reported 261 cases of monkeypox. Now look at this. Look at this right here. Minorities are bearing the brunt of monkeypox cases in the United States. How so? Minorities are? What do you guys think about that? Man, if they can't put a black face on it, I mean, they'll just shove one onto it. Oh, that's good, Eula. That's what's up. I'm glad she's watching. This channel right here is probably a channel that she'll like, because this is, we primarily talk about healthcare stuff. Doing Jar Jar Binks, you know what I'm saying? Jar Jar Binks, man, that's funny as hell. We need to be prepared, and this declaration will allow us to serve the city better, San Francisco Department of Public Health Director Dr. Grant Colfax said in a statement. Our C19 response has taught us that it is imperative that we mobilize city resources. The declaration helps us ensure we have all the tools available to augment outreach, testing, and treatment, especially to the LGBTQ plus community who remain at the highest risk for monkeypox. And that we said it. Val said she knew it would be NYC and San Francisco. All right, I'm going to ask everybody a question. Why? Why would it be NYC and San Francisco, guys? Huh? So now here it says the Biden administration continues to weigh whether monkeypox should be declared a public health emergency, federal health officials said on Thursday. Now, what is there to think about? Clearly, it's not being managed properly. Hey, Mr. Knickerbocker says, not to brag, knock on wood, I haven't even gotten the Rona yet. Well, if you don't knock on wood with latex gloves, you might mess around and get monkeypox. So now here it says, we continue to monitor the response throughout the country on monkeypox. Health and Human Services Secretary Xavier Becerra told reporters on Thursday. We will weigh any decision on declaring a public health emergency based on the response we're seeing throughout the country. The bottom line is we need to stay ahead of this and be able to end this outbreak, he continued. I think it's too late for that. It's too late for that. The window has closed on that. It's already out of control, and it's just going to get worse. They had plenty of time when they saw these starting to rise, in the pattern that they were rising in, with the community that they were starting to rise in. They should have started working on stopping it then. Yeah, that's facts, Eula. That's big facts. Yeah, absolutely, Black Manta. Crazy times we're witnessing. Crazy times we're witnessing. And what's the most interesting about a lot of this stuff to me is that a lot of this stuff is preventable, and there's not really much going on in the way of attempting to prevent it. It seems like a lot of people are just letting stuff happen, especially when it comes to the government. So now here it says, last week, the World Health Organization declared the monkeypox outbreak a public health emergency of international concern. Globally, more than 20,000 cases have been reported in over 75 countries, including dozens that have not historically reported monkeypox cases. And again, what they're acting like is that though monkeypox was not the result of lifestyle in Africa. All the new countries reporting monkeypox cases are because monkeypox spread is integrated in the kind of lifestyle a lot of those people have. And they're not talking about it in those terms. And instead of being honest about it, all they do is flick their hair back and thumbs down my video. All they do is flick their hair back and thumbs down my video. Real quick, guys, we got 7 people watching. Shouts out to all 7 people that are watching. And we got 9 likes. If everybody smashes that like button, we'll have 16 likes. So if everybody could smash that like button and help your boy out, that'd be great. Stop flicking your hair back and not liking the damn video. You know what I'm saying? U.S. health officials have warned for weeks that the number of monkeypox cases would likely increase nationwide as the government ramps up testing capability and surveillance. Is this a true statement? Is that true? I gotta agree with Black Manta. Black Manta says, in my opinion, I think they want this to affect us, but it's backfiring on them. I gotta agree. If you guys agree with that, give me a thumbs up. If you guys disagree with that, give me a thumbs down. So now here it says, we know monkeypox symptoms usually start within 3 weeks of exposure to the virus. So we can anticipate we may see an increase in cases throughout the month of July and into August. CDC Director Dr. Rochelle Walensky said during a press briefing earlier this month. Now, you know who I haven't heard say anything about monkeypox? I haven't heard Dr. Fauci say anything about monkeypox. Why not? Have any of you guys heard Dr. Fauci say anything about monkeypox? If you guys have heard Dr. Fauci say anything about monkeypox, give me a thumbs up in the comment section. If you haven't, give me a thumbs down, okay? Monkeypox is primarily spread through close physical contact between people. Symptoms include fever, headache, fatigue, and muscle aches. Patients can develop a rash and lesions that often begin on the face before spreading to the rest of the body. Most cases in the U.S. have been reported among the gay, bisexual, and other men who have sex with men community and related to male sexual contact. Remember in the beginning when this first came out, I kept asking, why are they not saying this in particular? Why are they not saying this in particular? Remember that? That was the question that I literally was asking, and it went from a laughing matter to actually a problem. It went from a laughing matter to an actual problem. You know what I'm saying? So now here it says, though health officials have repeatedly stressed that, see, this is the problem. Health officials have repeatedly stressed that the virus can affect anyone who has close contact with people who have monkeypox, which again is men who are having sex with men or going to those parties. We talked about this. Now, what if some LGBTQ person was offended by my video and decided to try to get my content taken down? Then now they turn around saying that they feel that they hadn't been adequately warned about this situation. In my opinion, that's one of the reasons why censorship is so important to monitor itself. People need to be aware of predatory censorship. And in a lot of cases, it's that particular community that participates in predatory censorship. And I got to agree with, hey, Mr. Knickerbocker, this disease is preventable, period. So now here it says those with weakened immune systems, pregnant people, and children under the age of 8 may be at heightened risk for severe outcomes, according to the CDC. Okay, so my question is, how many samples of people do we have in that demographic that we can say that about? How many samples of people in that demographic do we have that we can say that about? That's the question. Every American should pay attention on monkeypox, Becerra said. Monkeypox is not C19, but it is contagious. It can be painful and dangerous. Oh, yeah, I mean, we know that. So now that's that for this article. So now, according to a new report that came out from ABC, according to them, they're saying that minorities bear the brunt of monkeypox cases. Look at this. What minorities are they talking about? Hey, Mr. Knickerbocker says, after you exposed weeks ago, I was telling the worker at a store, and my dumbass husband was like, he's gay. Don't say that. I was like, well, if he is, he better strap up. He ain't. That's hilarious. But it's true, though. And that's a fact. Yulaw says, if you don't like Black Light Revelation C19, then you ain't shit. That's hilarious. So look at this, Michael Strahan. You know what I'm saying? This is life after that one lady from that show with Regis. You know what I'm saying? So this is interesting. So let's take a look and see what he has to say.
The growing concern this morning about the monkeypox outbreak. The U.S. now has more than 3,400 confirmed cases. Ariel Reshef is here with the latest. Good morning, Ariel.
Good morning to you, Michael. Cases of monkeypox are spiking here in the U.S., and New York is now the epicenter with the most reported infections. Health officials saying there's no reason to panic, but they are urging vigilance and say now is the time to stem the tide. This morning, monkeypox infections on the rise. The CDC now reporting over 3,500 cases, up from nearly 2,900 at the end of last week. Experts saying the spike may be due in part to more testing, but warn the true number could be much higher. Jonathan Araujo from Miami was hospitalized just after experiencing symptoms.
And I felt like a virus walking through that hospital. People were running, darting into rooms, putting on masks and gloves and like full body suits.
Jonathan saying at times it was excruciating.
And it felt like I was like someone was setting fire to my skin.
So is that the minority person? You know, this is interesting. When you're talking about white people, there's not a lot of questionable people who you can't identify as white who are all up in the camera. But then when they talk about minorities, there's all these different people who go from either being white to you don't know what race they are. So now how's that work? Yeah, we actually talked about the kids and women now coming up positive with monkeypox. Any kid that comes up positive with monkeypox, if you ask me, it should be an automatic CPS investigation.
Doctors say for now, most of the people getting sick are gay or bisexual men, but anyone may be at risk of getting infected. The virus most likely spreads with close, intimate physical contact, either face-to-face by respiratory droplets or skin-to-skin with an infectious rash. It can also spread through items such as clothing and linens.
I think it's, nothing to panic about, but it is something that we need to be aware of because I think we have a very short and closing window to get control of this virus.
I'm not trying to be funny, but this doctor right here, she looks like the type of woman that would be married to a guy that goes both ways. So while she's sitting up here, you know what I'm saying, giving all this information to ABC about monkeypox, she better be testing on her own You know what I'm saying? Because she gonna miss a couple of days of work when she find out that she ended up getting it. And she like, well, I don't know how I got it. Better go, you know what I'm saying? Check your man. You know what I'm saying?
In our community.
And with kids and parents looking to the start of the school year, experts saying there is minimal risk to children.
So not being spread in schools, not being spread at the park or on playgrounds.
And remember, there is an effective vaccine for monkeypox, but for now, it is only available to those considered at high risk. The CDC saying the protocol for everyone right now is similar to what we've all become accustomed to in fighting COVID. Extra.
Now, we're actually going to talk about this because there are some places that are only giving LGBTQ men the vaccine. So that's interesting. You know what I'm saying? And there's no outlash, no, outcry, blowback, like how there was with the C19 vaccine, when the very white people who were saying that C19 is fake were the ones who were rejecting the idea of a vaccine. But then when the vaccine was offered to non-white people, they were upset, saying that it was anti-white, that white people didn't get the option to get the vaccine. So there's that whole childish cultural thing going on at the same time.
For hand washing, using alcohol-based hand sanitizer, and avoiding any direct contact with people who may be infected.
All right, so there's that. Look at this. We got to look at this. 3 children, mother found dead, and a parent murder suicide. So we got some good, interesting news articles popping off, and I might have time to be able to do a video tonight. So if I do, my question for you guys is, do you guys want me to do a Black Light Revelations news reviews and reactions, or do you guys want me to do a video about the economy? Because there was a couple videos, there's a couple things about the economy I wanted to look at. Let me know what you guys want in the comment section, or you know what I'm saying, you guys just not want any videos at all. That's an option too. You know what I'm saying? Yeah, right. No, that's facts, Ghost Walker. I ain't even mad at it, bro. So let's actually look at this. All right. Minorities are bearing the brunt of monkeypox cases in the United States. New data from the Center for Disease Control and Prevention shows. Now, that's interesting how the majority of countries where monkeypox is happening is in Europe, but somehow in the United States, where most of the victims are, it's minorities who bear the brunt. How does that work? How does that work? Anybody got any answers for me on that? Does that make any sense? If that makes some sense, give me a thumbs up. If it doesn't make any sense, give me a thumbs down. So now here it says, during a telemedia briefing Thursday, Captain Jennifer McQuiston, Deputy Director of the Division of High Consequence Pathogens and Pathology at the CDC, shared the first breakdowns of infections by race and ethnicity. You guys ready for this? Of the more than 4,600 cases reported in the U.S., Hispanic and Black Americans make up a disproportionate share of cases compared to their share of the U.S. population. So you mean to tell me that Black people and Hispanic people are coming back from the European countries with monkeypox? You're trying to convince me of that? Where are they getting it from? Where are they getting it from? Hispanics account for 31% of all monkeypox cases in the country. Basically, this means white people account for 31% of monkeypox cases in the country so far, and black people make up 27% of the cases. Now, here's my question. How are Hispanics and black people getting it? How are they getting it? Where are they getting it from? And who are these people that have it? Let's follow the disease path and try to figure out how that makes any kind of sense. And real quick, ladies and gentlemen, we got 8 people watching and we got 9 likes. If everybody smashes that like button, we will have 17 likes. Remember, we got a goal of 100 likes per stream, and we can do it. So now here it says, however, according to data from the U.S. Census Bureau, Hispanics only make up 19% of the population, and black people may account for 13%. So there's that. That's according to the U.S. Census Bureau. So here we go, right here. All right. How's that work? You guys looking at the graph? Racial ethnic background, or I'm sorry, breakdown of monkeypox cases in the U.S. compared to the general population. White people make up 37% of the population, or 37% of the monkeypox cases, and 59% of the U.S. population. So what they're so now my question is, white people still have the highest percent of monkeypox cases. According to the graph, white people still make up the most. Hispanic people make up 31% of monkeypox cases, and they're 19% of the population. Now, I'll tell you how this works. There's far more gay white people than there are anybody else. And those gay white people have a spread trajectory. And that's why the numbers are almost directly proportional for black and Hispanic. Now, if you pay very close attention to Asian people are 6% of the population, and they only make up 4% of the monkeypox cases. So pay very close attention, right? Because if you look at this article, if you look at what it says as far as the title of it, minorities are bearing the brunt of monkeypox cases in the U.S. And this is according to the CDC. But how are they bearing the brunt of the cases if it's white people who have the most numbers? White people have 37% of monkeypox cases, which means that they're spreading it to more people. And that's true. I would say that there's a lot of honestly, I think that there's more interracial LGBTQ couples than there are heterosexual interracial couples. And that I find that interesting. Very, very interesting. Yeah. And I still believe that, Val. And what you see here is they're slowly trying to creep into a way of making black people the face of it. Trying to, at least. They can't really legitimately do it yet, but they're trying, though. And this is an attempt. They're going to try to see how many people bite. You know what I'm saying? So now here it says, by comparison, white Americans make up 37% of monkeypox cases while accounting for 59% of the U.S. population. But now what this white Americans doesn't take into consideration is how many of these Hispanics are white. Because Hispanic is the only grouping on here that's not a race. There are white people within this Hispanic designation, as well as black people within this Hispanic designation. And creating this Hispanic designation is how you artificially put a group of people in front of black people for politics. So what you're looking at right here, not only is this a monkeypox chart, but this is a political influence chart, except for the fact that the Asian political influence should be in front of black. But if you look at how political influence is supposed to take place based on population numbers, then this would be accurate if you're doing it based on population numbers. Hispanic is the only category on this graph that is made up of multiple races. Filipinos can technically be Asian or Hispanic. So Hispanic can have Asian in it. A lot of Cubans and Puerto Ricans and South Americans are black. Then there's Mestizo, which is basically a person who is a multi-generational mixed person. And then there's just the straight up white people. All of those fall under the umbrella of Hispanic, but they're not divided for population purposes here in the United States. But that's what you do. You create a big group like that, and then guess what? Now we have an artificial political group that has more political power, more political influence, more potential political power and influence than black people. So now there's a layer between black people and white people. Hence, that layer being a, quote, buffer, which is why people call those buffer classes, because it's a buffer between black people and white supremacy. Usually when there's graphs, they're good for more than one purpose. So now here it says only Asian Americans had roughly the same share of monkeypox cases compared to their share of the U.S. population, accounting for 4% of the cases and 6% of the population. Now, what I find fascinating is nobody's done studies about countries that are highly anti-LGBTQ. And nobody's talked about the spread of monkeypox in those countries. African nations, Arabic nations, Russia and China. I'd like to see the monkeypox spread statistics on those. I want to see monkeypox numbers in graphs. My bad. I didn't realize y'all can hear the styrofoam cup. The microphone picking up every damn thing. I got a smoothie from Smoothie King, and it's really good. It's the one that has all the antioxidants and vitamins and minerals to help prevent monkeypox. It costs a little bit more. I got a nice multicolored styrofoam cup with it, so don't be hating. Don't be hating out here now. You know what I'm saying? Don't be doing that. I got the nice echinacea shake. Yeah, microphone picking up every damn thing. I'm about to go take this motherfucker back. What else y'all heard that y'all wasn't supposed to hear? So now here it says it's incredibly important to understand the populations that are being impacted by the virus. Yes, it is. So let's talk about those white LGBTQ people, men, by the way. Because that is a population that's being affected worldwide. But for whatever reason, we're not talking about it. Anybody got any idea why we're not talking about it? I mean, we should be, in my opinion. If we want to indeed stop the spread on this thing. Real quick, ladies and gentlemen, we got 12 live viewers. Shouts out and thank you to all 12 live viewers who are watching. And we have 14 likes. If everybody could take a moment and smash that like button, we would be at 26 likes. So help your boy out, help the channel out, smash that like button. If you're not subscribed, go ahead and hit that bell icon. Unfortunately, minorities are being impacted the most. Is that what that says? Minorities are being impacted the most. Are minorities being impacted the most, or are minorities being disproportionately impacted? Let me ask you guys that question. See, because now what we've done here is we've caught the news and we've caught this physician in a lie. Most means largest number. Disproportionately means out of proportion. Are minorities being affected the most, or are minorities being affected disproportionately? Which one? I need everybody to answer that question in the comment section. Minorities are being impacted the most. It's not what the chart says. That's not what the chart says, now is it? And that's a good point. If we're talking about minorities, shouldn't LGBTQ be its own category on here? Oh, that's that intersectionality. Got it. That's that intersectionality. Val Williams says disproportionately. If you guys agree with Val, give me a thumbs up. If you guys disagree with Val, give me a thumbs down. It's incredibly important to understand the populations that are being impacted by the virus, and unfortunately, minorities are being impacted the most. Says Dr. John Brownstein. Pay attention to that. Dr. Brownstein. Sometimes certain people tend to purposely misquote things to cause confusion on purpose. Certain people do. An epidemiologist at Boston's Children's Hospital and an ABC News contributor said, it's not dissimilar to what we saw with C19. He continued, the concern you have is some of these populations are challenged in terms of access to testing and vaccination, and this puts the pressure on the public health officials to make sure that they have access to testing and vaccines. The CDC also said the median age of monkeypox patients is 35, with cases identified between those aged 17 to 76, excluding 2 pediatric cases. Additionally, the CDC said 99% of monkeypox patients are those who were of male sex at birth, and the vast majority of cases occurred during sexual contact, but there is no evidence that the disease is sexually transmitted. Really? Now, this is what the CDC said. This is what the CDC said. I want to make sure that you guys heard that properly. Do you guys agree with that statement? If you guys agree with that statement, give me a thumbs up. If you guys disagree with that statement, give me a thumbs down. Additionally, the CDC said 99% of monkeypox patients are those who were of male sex at birth, and the vast majority of cases occurred during sexual contact, but there is no evidence the disease is sexually transmitted. There's no evidence. There's no factors that would lead a logical-minded person to believe that this is sexually transmitted. Why is it that it's prevalent in a group of people that have a particular sexual lifestyle then? Why is it the most prevalent in a group of people that have a particular sexual lifestyle then? Does that make any sense? Oh, this is a brand new report. I got the date highlighted. July 28th of 2022 at 4:50 p.m. This report came out today. And now pay very close attention to how they added Black and Hispanic people together. Of course, if you add multiple groups of people together, they're going to make up more. Minorities are bearing the brunt of monkeypox cases. So what we're going to do is we're going to take the two largest minorities and add them together and show how they're doing worse than white people. We're not going to measure them separately. Does that make any sense? Shouts out to my man Conrad Murray. What up with it, bro? It doesn't make any sense. So now here it says the breakdown of cases by race and ethnicity is similar to what's been seen in localized outbreaks across the country. Joshua O'Neill, the sexual health program director of the state of Georgia's Fulton County Board of Health, which includes Atlanta, said during a virtual town hall July 21st that of the 106 people in the country confirmed with monkeypox, 63% are Black and 15% are white. Now, how is that when there's literally virtually no monkeypox cases popping off in Africa? All the monkeypox cases are going on in Europe, and most of these initial monkeypox cases happened through travel. Now, this is Georgia, where there's a lot of, fruit-flavored activity going on. So I honestly, I'll let them slide on this. I'll go ahead. I'll go ahead and go out on a limb and say that this, particularly in this particular locality, I'll go ahead and let them slide on that 63% are Black number. And in that area only, yeah, I'll give them that. I'll give them that one. We're talking about Georgia for sure. I'll give you that all day. Yeah, they got that. You know what I'm saying? Fruit flavored activity. Oh, man. So now here it says this is in stark contrast with the racial makeup of the country that shows 39% of residents of the county that shows 39% of the residents are white and 42% are Black, according to census data. So, I mean, of course, then black people would have more cases. Like, this isn't a mathematical anomaly. This is proportional. If it says this is in stark contrast with a racial makeup of a county that shows 39% of the residents are white and 42% are black. How is that in stark contrast? In this county, 63% of monkeypox cases are black and 15% are white. So, of course, the larger number of black people will have the larger number of cases, just like how up here, a larger number of white people has a larger number of cases. You know what I'm saying? So they're like, all they're doing here is just naming off a bunch of numbers and not actually making significant mathematic or statistical correlations with the numbers. That's all they're doing. Now, here's my question. What's the purpose in doing that? In Georgia, the gays don't mix race as much as other places, I think. That's probably because there's a higher concentration of black people there. I don't believe that everybody that is involved in a multicultural, multiracial relationship, quote, has this preference, like how YouTube likes to talk about these preferences. I don't think that that's the case at all. I think that that's just an easy overgeneralization to skirt actual facts. But that's just my opinion. You know what I'm saying? That's just my opinion. And honestly, if you ask me about the whole preference thing, I think that it's not possible for other groups of people to even have preferences. I think that it's only possible for white people to have preferences and everybody else has brain damage. But that's neither here nor there. That's a whole nother stream for a whole nother day. So now here it says in Santa Clara County in California, 45 miles from San Francisco, the public health department found that 41% of monkeypox cases among Hispanic, gay, and bisexual men as of Wednesday, despite Hispanic people making up 26% of the county's population. So now the only thing that this shows is that just like everything else, when something bad happens in the United States, minorities are disproportionately affected, which clearly shows that there's an issue with how resources are distributed. That's funny. It took that one bed winch to infect a whole bunch. So now, what do you guys think? What do you guys think about this? Nobody should be surprised because this is where we said that this would end up anyway. This is where we said that this would end up anyway. This was the logical progression of events. This is where we thought that this would be. And for whatever reason, the mainstream media was not showing it in that way. So now we had asked about Dr. Fauci, right? I forgot. I actually did have an article here where Dr. Fauci mentioned some things. So it's an article from The Hill. And real quick, if everybody could smash that like button. Also, if you haven't shared the video out, make sure that you take a moment and share the video out. And also, if you guys are not subscribed on Facebook or on Twitch, make sure you hit the description box and subscribe to those links over there on Facebook and on Twitch. Monkeypox emergency declaration under active consideration. Do you think that monkeypox should be considered an emergency? In my opinion, as usual, I think what we're witnessing is the United States failure to act yet again. We're witnessing the United States failure to act yet again. At this point, in my opinion, it should already be declared an emergency. And when it comes to being declared an emergency, this isn't something that they should be forcing on everybody. They should deal with this in terms of the population that it affects the most first. White House Chief Medical Advisor Anthony Fauci told CNN New Day on Tuesday that making an emergency declaration around monkeypox is under active consideration. Now, we're actually going to take a look at this. I'm about to follow this CNN New Day real quick, and we'll get back to what we were reading over there, because I think this is interesting. We asked about Dr. Fauci. Here he is. Okay. So now let's actually check this out and see what's said on here, shall we?
With more than 3,000 cases confirmed so far in the United States, cases of monkeypox, the White House is expected to name a monkeypox coordinator to help in the response to the outbreak. Joining us now is Dr. Anthony Fauci, Chief Medical Advisor on COVID to President Biden and Director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, thank you so much for being with us. What specifically would a monkeypox coordinator do, and how difficult has this been for the administration to get its arms around over the last several months?
Well, it certainly is a serious problem, and that's the reason why there's consideration for getting someone to be responsible for the overall coordination. There are several aspects of it. I mean, obviously, as an infectious disease problem, as you showed the numbers, John, it's a growing problem. The World Health Organization has declared it a public health emergency of international concern. There are now over 80 countries throughout the world who have cases, more than 16,000 cases in non-endemic countries. So this is something we're taking very seriously. And when you have something like that, you want coordination among all the different agencies.
Now, do you guys think that this has been taken seriously? I don't. I don't think that this has been taken seriously at all. If you all feel that monkeypox has been taken seriously, give me a thumbs up. If you guys don't feel that it's been taken seriously, give me a thumbs down.
The research, the public health, there are 3 issues and 1 outreach. So the 4 pillars that we take are obviously testing, increasing the testing, which has been done rather dramatically from about 6,000 tests a week to now about 80,000 tests a week. Then there's the vaccine, which is going to be distributed in a way that is equitable for people who are post-exposure, as well as those who are in risk of getting infected and have a pre-exposure. And then you have therapy, which you've got to make sure that the paperwork and the logistic constraints associated with the distribution of therapy are brought down to a very, very low minimum. So those are the kind of things that you want someone to actually coordinate all of those things to get a much better response. We're doing well, but we've got to do much better.
Much better. How? I mean, when you say much better, has there been a slow response to this?
Well, John, it depends what you mean, because early on, when
Yeah, no, it doesn't depend on shit. Shut up, Fauci. My question for you guys is, do you guys think that there's been a slow response to this? If you guys think that there's been a slow response to this, give me a thumbs up. If you guys don't feel that there's been a slow response to this, give me a thumbs down. Shouts out to my man Bronze the God. What up with it, bro?
the outbreak was noticed, the strategy was a post-exposure prophylaxis, which is the standard way of this type of a pox virus, that you would get it to the person who in fact has been infected and those around them, sometimes referred to as ring vaccination. But it's very clear with the spread of this that there now has to be a balance between vaccines available for those who clearly have been exposed, as well as those at risk. And that's where the change in the distribution, so that you anticipate that someone might get infected, as opposed to responding to someone who is infected. And that's the way the strategy is going right now.
The WHO, as we noted, has declared an emergency. Should the United States declare a public health emergency on this?
John, I'm not going to get ahead of that. I mean, that's something that's obviously on the active consideration, but I don't want to be giving an opinion until we sit down with the team and talk about whether that happens or not.
So now here's my question for you guys. Do you all feel that the United States should consider this an emergency? I feel that it should be considered an emergency, and the people who are in the demographic, which would be the LGBTQ, that this is affected first, should be the one that the recommendations are targeted at first. So if one of the recommendations is use protection, make sure that you're talking about those guys who have those slosh parties using protection. You know what I'm saying? That's what they need to be doing. I'm dead serious. And I gotta agree, Donna. But do you know, we just read an article where the LGBTQ community feels that this isn't being talked about honestly enough. So how does that work? Because originally they were tap dancing around everything to try to stop from stigmatizing the disease. So how does that work?
That would not be appropriate.
So who needs to be vaccinated right now? And is this a situation, if and when there's enough vaccine, that ultimately the whole larger populations will get vaccinated?
No, the whole population doesn't need to get vaccinated.
I don't think
the whole population doesn't need to get vaccinated. Those people who like to have 2 pigs in 1 blanket need to be vaccinated. Those are the people that need to be vaccinated. You guys ever had pigs in a blanket? You know how you put the wiener inside of the biscuit dough? People who have 2 wieners in the biscuit dough, that's who needs to have the vaccine recommended for them. What's so hard about saying that? What's so hard about saying that? You know what I'm saying? Recommend the vaccine for those people. Also, they need to go ahead and make some commercials like James Bond or Mission Impossible. Dun 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 dun. Do you live a secret life? Are things about your life undercover? Be considerate to everyone involved in your murder mystery. Get the monkeypox vaccine now. Oh man, that's what they need to do. Oh man. You guys agree with that or y'all disagree? Go ahead, You know what I'm saying? Make sure that the people who are engaging in these kind of behaviors unapologetically are getting the correct and appropriate recommendations, and also reach out to the people that are undercover. Reach out to the Mission Impossible crowd. Make it a mission possible to avoid monkeypox.
That you're going to have the entire population. I mean, obviously, you leave the door open for any possibility, but I would doubt that that's the case, because what we're seeing right now, and it could change, it could go beyond the population of men who have sex with men. But if you look at the number of vaccines available, early on, we've now distributed about 323,000 doses that have been distributed now. And within, I hope, a few days, John, maybe hopefully by the end of July, there'll be an additional 800,000. So what you want to do is a balance between vaccinating those who clearly...
Look. Check this out. Check this out. Check this out. They're trying to prevent a disease that gets spread by injecting stuff. Let that marinate. Let that marinate real quick.
have had an exposure, but go well beyond that. For example, if you look within the population of men who have sex with men, those who are on pre-exposure prophylaxis for HIV and are at risk, those are the people that you want to vaccinate in a pre-exposure prophylaxis, as well as men who have sex with men who are HIV infected, but who are low in essentially undetectable viral load, who they know they're not going to transmit to someone else with HIV.
He's talking about these viral loads and all this. It's part of the problem, people taking loads.
They may be quite at risk for monkeypox. So you're going to want to vaccinate those. So there's an entire layered group of people who are at risk. That's what we need to do.
Very quickly, I do want to ask you about coronavirus. The president's exposure, we saw him yesterday. We've been told he is recovering quite well at this point. Any new update on his condition?
That's too bad. Yeah, I mean, I was speaking with his physician, Dr. Kevin O'Connor, last night. He's completed his 5 days. Now the decision is about where are we going to go from here regarding continued testing, and how soon can we get him out back to the... He's doing his job right now, for sure, virtually. But how do we get him back out? He's feeling really very well. In fact, each day he improved more and more to the point now where he really does feel quite well.
Has he tested negative yet?
You know, I don't know, but I doubt it, to be honest with you, John. I know that you know, it would be unusual to test negative so quickly.
I have two more questions. So with him, it does raise the question. One of the things I know you'll be looking for.
Man, you know what's funny? Man, Dr. Fauci be babbling, don't he? Dr. Fauci be babbling, don't he?
For signs of long COVID going forward, just because he's had it and everyone is concerned about this. For all of us, what should we look for in terms of symptoms of long COVID? When should we go to a doctor with those concerns?
Well, the constellation of signs and symptoms, John, for long COVID are very, very protean. There's so many different ones. The ones that are the most common is exhaustion following activity that normally would not exhaust you. That's the first thing. Then there's temperature dysregulation. You feel chilly, maybe some sleep disturbances, sometimes difficulty in concentrating. The thing that's going in the positive direction for the president, he's vaccinated, he was doubly boosted, he had a good immune response, and he was on Paxlovid very, very early. So the viral replication in him was suppressed very, very early by the Paxlovid. Hopefully that's going to be something that'll put him way out of a risk. There's always a risk, and that's what you look for. But that's something that is unlikely with him because of the circumstances that I just mentioned.
So when we last spoke, I'd asked you about when and if there would be a government recommendation.
Real quick, ladies and gentlemen, shouts out to everybody that's watching. We got 13 people watching, and we also have 18 likes. If everybody could smash that like button and get us to 31 likes, that would be great.
For people under 50 to get that second booster shot. At this point, is it worth waiting for the reconstituted booster that will deal directly with these Omicron variants that we're seeing?
So now that's another thing. I don't know if you guys are all caught up with all the videos on this channel. But how many people were aware that they're coming up with a vaccine that's specifically for BA4 and BA5? If you guys are familiar and you guys were aware that they're coming up with a separate vaccine that's specific to Omicron variant BA4 and BA5, give me a thumbs up in the comment section.
Well, John, it depends if you're talking about select group of people who are at risk or the general population. The FDA still has not made a definitive determination about how to balance the need of someone who's at risk for severe complication now, who hasn't been boosted in a while, versus getting a vaccine in the fall that might be more specific to the circulating variant. One thing you don't want to do, John, you don't want to withhold a vaccine for someone who hasn't had a vaccine for a while, who's at risk, a pregnant person, someone with an underlying congestion, congestive heart failure, chronic obstructive pulmonary disease. As a physician, if I had someone at risk and hasn't been vaccinated with a boost in several months, I would not want to wait a few months. I would want to get them covered now. And then when you get to the fall, then you're concerned about when you're going to give them that additional boost. But you don't want to hold back in a high-risk person.
I too want to leave you with this, which is politics. I know one of your least favorite subjects here. Senator Rand Paul, a Republican, and some Republicans are talking about what they might do if they retake the House or the Senate in the fall. Senator Rand Paul says of the Republicans, if they retake the House, one way or another, if we are in the majority, we will subpoena your records, and he will testify in the Senate under oath. Your reaction to Rand Paul and others saying they're going to investigate you if they take power?
Well, there's no reason to do that, but if they want to, go ahead. My records are an open book. They are talking about things that are really bizarre, John, like crimes against democracy by shutting down the government. All I have ever done, and go back and look at everything I've ever done, was to recommend common sense, good CDC recommended public health policies that have saved millions of lives. If you want to investigate for me for that, go ahead.
Dr. Anthony Fauci, appreciate you being with us this morning. Thank you.
I don't know why that's so funny. I don't know why that's so funny. You know what I'm saying? But it is. So I don't know if you guys are aware, but it looks like black people is trending on Twitter. That's interesting. They got an interesting little article here by the Daily Beast. I got a question for I think I asked this question already, but just to be on the safe side here. How many people would be interested in watching another stream tonight? Either on Blacklight Revelations or Blacklight Revelations news, reviews, and reactions. If you guys are interested in a stream on Blacklight Revelations news, reviews, and reactions, or just another stream, give me a thumbs up in the comment section. If not, give me a thumbs down. I swear I just can't keep up with all this damn shit. I swear I can't keep up with all this shit. My man Black Manta says he's down. Hey, that's what's up. Mr. Knickerbocker said she'll let it play. All right, so we might have to do that. We might have to do that. All right. So let's get back to this. It might be kind of late. Shit, by that time, I might not even feel like doing it. Oh, look at this. Look at this. Look at this. Wait a minute. Hold on real quick. California police sergeant resigned after engaging in oral sex on duty. You guys see that on the side over there? Oh, there it is right there. It's right up on the screen. California police sergeant resigned after engaging in oral sex. Now, he could get monkeypox. No reason for him to be out there engaging in such degeneracy in California where there's all kinds of shit popping off. Literally all kind of shit popping off. You out there getting head. You know what I'm saying? People worried about getting monkeypox, and you out there just having a grand old time and shit. What's up with that? They said he was engaging. They said that motherfucker was engaging in oral sex. That's a no-no, especially in California. Yeah, people getting the monkeypox in the mouth. They're getting it in the throat from swallowing. You know what I'm saying? Just straight up doing a lot out here. So now here it says the White House chief medical advisor Anthony Fauci told CNN New Day, which is what we just watched on Tuesday, that making an emergency declaration around monkeypox is under active consideration. That's something that's obviously under active consideration. Fauci, also the director of National Institute of Allergy and Infectious Disease, said when New Day anchor John Berman asked him about an emergency declaration for the virus. Fauci said of the response to monkeypox overall, we're doing well, but we've got to do much better. I don't think we're doing well at all. And I think the window for wanting to do much better is closed. That's what I think. At least in my opinion, that's what most of the evidence says. And real quick, ladies and gentlemen, we got 14 live viewers. Shouts out and thank you to all 14 people who are watching. And we got 19 likes. If everybody takes a moment, smashes that like button, we'll have 33 likes. So let's get there. Monkeypox primarily affects, here we go, men who have sex with men. And that's not just according to Fauci. I mean, that's according to what the data shows. That's according to what the data shows. But can be more concerning in those already diagnosed with viral infections such as HIV. Shit, the common cold is detrimental to somebody that's got HIV. So now if you look on the side here, you see it says Biden's administration is expected to soon declare monkeypox a health emergency. That's what they're expected to do. That's an article from Politico. But they're saying that the Biden administration is expected. They're expected to declare monkeypox an emergency soon. In my opinion, it's a little bit too late. That's another point that political opposition can drive home, is the late and failed response to monkeypox. I think it's safe to say that there's been a late response, and I think it's safe to say that they failed in early detection. What do you guys think? So now here it says there's an entire layered group of people who are at risk, Fauci said, emphasizing that vaccination against monkeypox should be spread beyond the group of people who have already been exposed to the virus. That to me is dangerous language, and I don't think that everybody needs to be recommended that. I think that the specific group of people who has it and who's spreading it is who should be recommended the vaccine. And remember, recommendations aren't a requirement, so all they have to do is recommend. And that's all I'm saying that needs to be done is a recommendation. What do you guys think? Would you guys agree with that or would you disagree? So now here it says Fauci also touched on the condition of President Biden, who announced on Thursday that he tested positive for C19. When Berman asked if Biden had tested negative yet, Fauci said, "I don't know, but I doubt it. It would be unusual to test negative so quickly," he elaborated. Fauci said he had discussed the president's condition with White House physician Kevin O'Connor on Monday and that Biden seemed to be doing well. He's completed his 5 days. Now the discussion is about what are we going to do and go from here regarding continued testing and how soon we are going to get him back out. He's doing his job right now for sure virtually, but how can we get him back out? Fauci said. I don't think he's been doing his job at all before or after C19. I don't think Joe Biden has been doing a good job at all. So now here it says he continued to speak of Biden. He's feeling really very well. In fact, each day he's improved more and more to the point now where he really does feel quite well. Okay. What does all of that mean? So now again, what they're saying is that the Biden administration is expected to soon declare monkeypox a health emergency. Do you guys think that that's jumping the gun? Now, again, what I find fascinating is that there's a lot of people that think that, again, they don't think that this is real. Now, what I find very interesting about this denial of stuff is that it's a lot of white Christian conservatives that deny this stuff. They say that this stuff isn't real. It's not going on. But in their very Bible that they worship, they talk about plagues and pestilence and who it happens to. And yet and still, they say that this is crisis actors and fake diseases. But yet, I mean, you can reference their own religion for some sorts of accounts of things similar to this. So again, you have to pay attention to who's causing a lot of the mis and disinformation. And that's true. Hey, Mr. Knickerbocker, that's very important to consider. You know what I'm saying? The amount of deaths per vaccine available. That ratio is damn near non-existent. So that's something that people need to look at and take into consideration as well. You know what I'm saying? And that you'll find that a lot of times when it comes to dealing with these particular kinds of situations, you'll find that there's no evidence of anything. Nothing ever makes sense. And that's why it's important to go over all of this stuff. Because if you don't go over it, there's no way for there to be any kind of exposure. You know what I'm saying? So now here it says the Biden administration is expected to declare monkeypox a public health emergency in the coming days, according to 2 people with knowledge of the matter. So now, who are these 2 people with knowledge of the matter? Like, this is what the media does. They'll just say, oh, yeah, just so you know, like, this person said this. Like, most media is based on hearsay. Who are these 2 people that said that? How do we know that they're credible? Yeah, you know, I just want to let you know what I'm saying? These 2 motherfuckers that was close to the matter said this. Like, okay, who are they? We can't tell you. They just 2 motherfuckers close to the matter. Like, it could be a crackhead that's outside eating a Polish boy, you know what I'm saying, panhandling, that said that. We don't know who this person is. We don't know who any of these people are. Why is it that the media doesn't have to reveal their sources? And so then when they say that they have a primary source, but then they report information from that source anonymous, Why do we need to trust it? Why do we owe them trust? My question is, if they can't give up the source, should we validate that information, or should we automatically assume that that information is legitimate? I don't think that we should. I don't know why people do. So that's something to think about there. You know what I'm saying? So now here it says the declaration, which is made by the Department of Health and Human Services, would follow a similar decision made last weekend by the World Health Organization by designating the outbreak of an emergency. HHS could then take a slew of actions, including assessing new money and appointing new personnel, according to the law that dictates how and when the federal government can declare such an emergency. The people with knowledge of the matter said the declaration is expected as soon as the end of the week, but the decision is not yet final, and a spokesperson for HHS said the agency is continuing to explore options. HHS Secretary Xavier Becerra is scheduled to hold a press conference on monkeypox on Thursday morning. A spokesperson for the White House said that there were no updates at this time. Now, I don't think that the White House is going to I don't think that they're going to do it as of right now, but I think they are going to do it. I think that it's going to get a little bit worse. And then once it gets to the point where there's an actual panic, then they're going to do it. Then they're going to do it, if you ask me. So now here, look at this. This is what Biden officials have for days debated whether to declare monkeypox a public health emergency, as health officials in the U.S. and at the WHO this week said the risk to the general population is low. I mean, again, but the disease is out of control. Like, the disease is out of control, though. You know what I'm saying? HHS has declared several public health emergencies in recent years, including C19 and the opiate crisis. Did you guys know that the opioid crisis was considered a public health emergency, but the crack epidemic was not? How many people knew that the opioid crisis, the opioid addiction crisis, was considered a public health emergency? If you guys knew that, give me a thumbs up. If you guys didn't, give me a thumbs down. I do think it deserves to be one, said Tom Inglesby, director of the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health. We're having a lot of challenges around the country with their rate of rise in terms of new cases. It isn't, look at this, it isn't an emergency posing a high threat to the general population. It's still moving and has the potential to spread additional vulnerable communities. Now, what does that mean? What does that mean? It's still moving and has the potential to spread to additional vulnerable communities. How would that happen? The conversations about such a declaration come as the virus continues to spread throughout the country. In U.S., nearly 3,600 cases have been reported. So you guys know this has to be old, because now we're at 4,900. Carlton Way says means they're about to give it to black people. Facts. Facts. New York City, look at this. New York City remains the epicenter of the outbreak, with the most cases occurring among men who have sex with men. New York City remains the epicenter of the outbreak, with most cases occurring among men who have sex with men. What do you guys think about that? Men out here having sex with men. That's where the outbreak is coming from. That's wild. The CDC on Tuesday said it was making monkeypox a nationally notifiable condition, which directs state public health agencies to use a certain definition for identifying cases and follow a specific rubric when submitting surveillance data to the agency. The move will allow the CDC to more closely monitor the spread across the country. Still, concerns about the virus spread have caused some within the administration to worry about the future transmission given to the lack of available vaccine doses. The Biden administration has also faced growing criticism over the pace of its response from public health experts who fear the window to contain and eradicate the disease is closing. Again, like I said, in my opinion, that window is already closed. In my opinion, like I've said multiple times, that window is already closed. Oops. I didn't mean to do that. HHS is expected to announce the release of several 100,000 more doses this week after the Food and Drug Administration said it had completed its inspection of the vaccine at manufacturing sites in Denmark. Remember, Denmark is where monkeypox was originally first discovered. And then somehow magically it showed up in Africa. So, I mean, there's this monkeypox popping off all over the place. They're all over the place, even in places where you don't expect them. You really only hear about New York and LA and all of that. If I'm not mistaken, this is Nevada. 5 additional monkeypox cases reported in Riverside County, including first and western portion of the country. I'm sorry, of the county. So this person here says Rivco Public Health is reporting 5 more confirmed probable monkeypox cases. 4 are East County residents. 1 of them is from Western Riverside County. All are men between 40 and 71. All are men. Riverside County Public Health on Tuesday reported an additional 5 probable and confirmed monkeypox cases in the eastern and western portions of the county. County spokesperson Jose Arballo Jr. said on Twitter that 4 individuals are East County residents and 1 person is from Western Riverside County, making it the first Western County case. All are men between the ages of 40 and 71. All of them are men. He ought to be ashamed of his old ass. There have been at least 18 probable or confirmed cases of monkeypox reported in Riverside County as of Tuesday. In California, there have been 646 probable and confirmed cases. Monkeypox is a rare disease caused by the monkeypox virus. People usually become infected through close contact with skin lesions or bodily fluids of infected animals or humans, including droplets, and can also be spread through sexual contact, yet we're not going to consider this an STD. Symptoms can occur 5 to 21 days after exposure and include fever, headache, muscle aches, swollen lymph nodes, rash, and lesions, often in the genital and perineal area. Illness typically lasts for 2 to 4 weeks. Anyone who believes that they have been exposed to monkeypox should contact their healthcare provider. What do you guys think? It's not slowing down. And I don't think we're going to see a slowdown of it. So, ladies and gentlemen, more than likely, I'll be live again. We'll be talking about some news, probably either on Blacklight Revelations 1 or on Blacklight Revelations News Reviews and Reactions. Or we might just, I don't know, just make sure you guys got the bell icon hit, and I will catch you all on the next video. Let me know what you guys think about this in the comment section. If you haven't smashed the like button yet, make sure that you guys smash that like button and share the video out, and make sure you guys tell a friend about this channel. I appreciate each and every one of you for watching. I will catch you all on the next one. Peace.